1. A nurse is preparing to administer digoxin to a patient with heart failure. Which of the following actions should the nurse take before administration? 1. Assess the patient's respiratory rate. 2. Check the patient's blood glucose level. 3. Measure the patient's apical pulse for 1 minute. Answer. Measure the patient's apical pulse for 1 minute. Explanation. Digoxin can cause bradycardia. Therefore, the nurse must assess the apical pulse before administration. If the pulse is below 60 bpm, the medication should be held and the provider notified. 2. A nurse is caring for a patient receiving warfarin. Which lab value is most important to monitor to assess the medication's effectiveness? 1. Hemoglobin. 2. INR. 3. Platelet count. Answer. INR. Explanation. The International Normalized Ratio, INR, is the key indicator for assessing the effectiveness of warfarin therapy. Therapeutic range is typically 2.0 to 3.0 for most indications. 3. A nurse is teaching a patient who has been prescribed lithium. Which of the following statements by the patient indicates a need for further teaching? 1. I will maintain a consistent sodium intake. 2. I should avoid dehydration. 3. I can take ibuprofen for headaches. Answer. I can take ibuprofen for headaches. Explanation. NSAIDs like ibuprofen can increase lithium levels, potentially leading to toxicity. Patients should be advised to use acetaminophen instead. 4. A nurse is caring for a patient receiving vancomycin 4. The nurse notes redness and flushing of the face and neck. What is the most appropriate action? 1. Stop the infusion immediately. 2. Decrease the infusion rate. 3. Administer diphenhydramine. Answer. Decrease the infusion rate. Explanation. The symptoms suggest red man syndrome, a reaction due to rapid infusion of vancomycin. Slowing the rate usually resolves symptoms. 5. A nurse is caring for a client who takes levothyroxine. Which findings should the nurse report to the provider? 1. Heart rate of 58 bpm. 2. Temperature of 36.7 degrees Celsius. 3. Weight loss of 4 kilograms in 2 weeks. Answer. Weight loss of 4 kilograms in 2 weeks. Explanation. Rapid weight loss may indicate overdosage or hyperthyroidism. Levothyroxine dosage may need adjustment. 6. A nurse is reviewing a new prescription for furosemide. Which electrolyte imbalance should the nurse be most concerned about? 1. Hypernatremia. 2. Hypokalemia. 3. Hyperkalemia. Answer. Hypokalemia. Explanation. Furosemide is a loop diuretic that causes potassium loss through the urine, increasing the risk for hypokalemia. 7. A nurse is caring for a patient receiving morphine for pain. Which findings should the nurse prioritize? 1. Constipation. 2. Nausea. 3. Respiratory rate of 8 per minute. Answer. Respiratory rate of 8 per minute. Explanation. Respiratory depression is a life-threatening side effect of opioids. A rate of 8 breaths/min requires immediate intervention. 8. A patient is starting isoniazid for tuberculosis. Which lab value should be monitored closely? 1. Creatinine. 2. ALT/AST. 3. Hemoglobin. Answer. ALT/AST. Explanation. Isoniazid is hepatotoxic. Liver function should be monitored to detect early signs of liver damage. 9. A nurse is educating a patient about nitroglycerin sublingual tablets. Which statement indicates proper use? 1. I will swallow the tablet with water. 2. I can take up to 3 doses 5 minutes apart. 3. I should chew the tablet for faster effect. Answer. I can take up to 3 doses 5 minutes apart. Explanation. Nitroglycerin is taken sublingually, not swallowed or chewed, and can be repeated every 5 minutes up to 3 times if chest pain persists. 10. A nurse is administering for potassium chloride. Which action is appropriate? 1. Administer for push over 2 minutes. 2. Infuse using a pump over prescribed time. 3. Mix with dextrose solution and shake vigorously. Answer. Infuse using a pump over prescribed time. Explanation. For potassium must never be given as a bolus or push. It should be diluted and administered slowly using a pump. 11. A nurse is caring for a patient on heparin therapy. The patient begins bleeding excessively. Which medication should the nurse prepare to administer? 1. Vitamin K. 2. Protamine sulfate. 3. Naloxone. Answer: protamine sulfate. Explanation: protamine sulfate is the antidote for heparin overdose and helps reverse its anticoagulant effects. 12. A nurse is teaching a patient taking phenytoin. Which instruction is most important to include? 1. You may stop taking the drug if seizures stop. 2. Avoid alcohol while taking this medication. 3. Take the medication only with dairy products. Answer: avoid alcohol while taking this medication. Explanation: alcohol can increase phenytoin toxicity or reduce effectiveness and may also trigger seizures. 13. A patient receiving gentamicin reports ringing in the ears. What should the nurse do? 1. Document the finding as expected. 2. Hold the dose and notify the provider. 3. Increase fluid intake. Answer: hold the dose and notify the provider. Explanation: tinnitus is a sign of ototoxicity, a serious adverse effect of aminoglycosides like gentamicin. 14. A nurse is reviewing the MAR and notices a new prescription for lisinopril. What should the nurse assess before administration? 1. White blood cell count. 2. Potassium level. 3. Glucose level. Answer: potassium level. Explanation: ACE inhibitors like lisinopril can cause hyperkalemia. Potassium should be within normal limits before administration. 15. A nurse is administering insulin aspart to a patient before breakfast. What is the appropriate nursing action? 1. Administer 30 minutes before the meal. 2. Administer immediately after the meal. 3. Administer within 5 to 10 minutes before the meal. Answer: administer within 5 to 10 minutes before the meal. Explanation: insulin aspart is rapid-acting and should be given close to mealtime to prevent hypoglycemia. 16. A nurse is teaching a patient prescribed prednisone for long-term therapy. Which instruction is essential? 1. You can stop the medication when symptoms resolve. 2. Take the medication with food. 3. Avoid dairy products while on this drug. Answer: take the medication with food. Explanation: prednisone can irritate the gastric mucosa, so it should be taken with food to minimize GI upset. 17. A patient is starting sertraline. What is a priority instruction to reduce the risk of serotonin syndrome? 1. Avoid dairy products. 2. Do not take with MAOIs. 3. Limit fluid intake. Answer: do not take with MAOIs. Explanation: combining SSRIs like sertraline with MAOIs increases the risk of serotonin syndrome, a potentially fatal condition. 18. A nurse is reviewing the home medication list of a patient prescribed spironolactone. Which medication raises concern for a potential interaction? 1. Furosemide. 2. Lisinopril. 3. Amlodipine. Answer: lisinopril. Explanation: both spironolactone and lisinopril can raise potassium levels, increasing the risk for hyperkalemia. 19. A patient with asthma is prescribed theophylline. What should the nurse instruct the patient to avoid? 1. Green leafy vegetables. 2. Grapefruit juice. 3. Caffeine. Answer: caffeine. Explanation: theophylline has a narrow therapeutic index and caffeine can increase its effects and toxicity. 20. A nurse is reviewing discharge instructions for a patient prescribed metronidazole. Which of the following is most important to include? 1. Take with dairy products to reduce GI upset. 2. Avoid alcohol during treatment. 3. Discontinue if you experience dark urine. Answer: avoid alcohol during treatment. Explanation: combining alcohol with metronidazole can cause a disulfiram-like reaction including nausea, vomiting, and flushing. 21. A nurse is caring for a patient who is prescribed albuterol for asthma. Which assessment finding indicates a common adverse effect of this medication? 1. Bradycardia. 2. Tachycardia. 3. Hypoglycemia. Answer: tachycardia. Explanation: albuterol is a beta-2 agonist that may stimulate beta-1 receptors, leading to increased heart rate as a common side effect. 22. A nurse is educating a patient about taking a newly prescribed statin. Which instruction is most important to reduce the risk of serious complications? 1. Report muscle pain or weakness immediately. 2. Avoid green leafy vegetables. 3. Take the medication on an empty stomach. Answer: report muscle pain or weakness immediately. Explanation: statins can cause rhabdomyolysis, a serious condition indicated by unexplained muscle pain or weakness. 23. A patient is receiving a continuous 4 infusion of insulin. Which lab value requires immediate intervention? 1. Potassium level of 3.0 milliequivalent/L. 2. Glucose level of 150 milligrams per deciliter. 3. Hemoglobin A1C of 6.5%. Answer: potassium level of 3.0 milliequivalent/L. Explanation: insulin drives potassium into cells, which can worsen hypokalemia. A potassium level of 3.0 milliequivalent/L is dangerously low. 24. A nurse is monitoring a patient on clozapine. Which lab value is the priority to monitor? 1. White blood cell count. 2. Serum sodium level. 3. Creatinine level. Answer: white blood cell count. Explanation: clozapine can cause agranulocytosis, a potentially life-threatening decrease in WBCs. Monitoring WBCs is essential. 25. A nurse is administering methotrexate to a patient with rheumatoid arthritis. Which instruction should the nurse provide to minimize complications? 1. Take with vitamin C daily. 2. Avoid folic acid supplements. 3. Avoid crowds and people who are sick. Answer: avoid crowds and people who are sick. Explanation: methotrexate is an immunosuppressant, increasing infection risk. Patients should avoid potential sources of infection. 26. A nurse is preparing to administer naloxone to a patient with suspected opioid overdose. What is the nurse's priority action after administration? 1. Administer a second dose immediately. 2. Monitor respiratory rate and oxygen saturation. 3. Encourage the patient to drink fluids. Answer: monitor respiratory rate and oxygen saturation. Explanation: naloxone reverses opioid-induced respiratory depression. Continuous monitoring is critical as effects may wear off before the opioid is cleared. 27. A patient prescribed levodopa/carbidopa for Parkinson's disease reports nausea. What is the nurse's best advice? 1. Take the medication with a high-protein meal. 2. Take with food but avoid high-protein meals. 3. Crush the tablet for easier swallowing. Answer: take with food but avoid high-protein meals. Explanation: food can reduce nausea, but high-protein foods interfere with drug absorption in the brain, reducing effectiveness. 28. A nurse is caring for a patient receiving enoxaparin. What should the nurse do before administering this medication? 1. Aspirate before injecting. 2. Check platelet count. 3. Mix with insulin for injection. Answer: check platelet count. Explanation: enoxaparin can cause heparin-induced thrombocytopenia, HIT, so the platelet count should be checked before administration. 29. A nurse is educating a patient on the use of a fentanyl transdermal patch. Which statement indicates understanding? 1. I can use a heating pad over the patch for pain. 2. I will fold the used patch and flush it down the toilet. 3. I should cut the patch in half if I feel dizzy. Answer: I will fold the used patch and flush it down the toilet. Explanation: flushing used fentanyl patches prevents accidental exposure or misuse. Heat increases absorption and must be avoided. 30. A patient with a history of peptic ulcer is prescribed ibuprofen for arthritis. Which action should the nurse take first? 1. Educate the patient to take the medication with food. 2. Notify the provider of the patient's history. 3. Administer the medication with a glass of milk. Answer: notify the provider of the patient's history. Explanation: NSAIDs like ibuprofen can worsen or cause peptic ulcers. The provider should be informed before proceeding. 31. A nurse is caring for a patient on amiodarone. Which assessment finding requires immediate intervention? 1. Blue-gray skin discoloration. 2. Productive cough with dyspnea. 3. Mild bradycardia. Answer: productive cough with dyspnea. Explanation: amiodarone can cause pulmonary toxicity. Cough and dyspnea may indicate serious complications requiring immediate attention. 32. A nurse is reviewing medications for a client newly diagnosed with glaucoma. Which medication should the nurse question? 1. Timolol. 2. Latanoprost. 3. Diphenhydramine. Answer: diphenhydramine. Explanation: diphenhydramine has anticholinergic effects that may increase intraocular pressure and worsen glaucoma. 33. A nurse is preparing to administer sucralfate to a patient with peptic ulcer disease. When should this medication be given? 1. After meals and at bedtime. 2. 30 minutes before meals and at bedtime. 3. With meals and snacks. Answer: 30 minutes before meals and at bedtime. Explanation: sucralfate forms a protective coating over ulcers and should be taken before food to be effective. 34. A nurse is administering 4-ceftriaxone to a patient with a severe penicillin allergy. What should the nurse do first? 1. Administer a test dose. 2. Hold the medication and notify the provider. 3. Monitor for hypertension. Answer: hold the medication and notify the provider. Explanation: cephalosporins like ceftriaxone can cross-react with penicillin in some patients, posing a risk for anaphylaxis. 35. A patient is prescribed tetracycline for acne. What teaching point is most important to include? 1. Take with milk to decrease GI upset. 2. Avoid sun exposure and use sunscreen. 3. Discontinue the drug when acne improves. Answer: avoid sun exposure and use sunscreen. Explanation: tetracyclines cause photosensitivity, increasing the risk of sunburn. Patients should be advised to protect themselves from sunlight. 36. A nurse is administering atropine preoperatively. What is the expected therapeutic effect? 1. Promote sedation. 2. Reduce oral and respiratory secretions. 3. Lower blood pressure. Answer: reduce oral and respiratory secretions. Explanation: atropine is an anticholinergic used preoperatively to dry secretions and prevent aspiration. 37. A patient on long-term corticosteroid therapy is scheduled for surgery. What is the nurse's priority action? 1. Teach deep breathing exercises. 2. Monitor for signs of infection. 3. Inform the provider about corticosteroid use. Answer: inform the provider about corticosteroid use. Explanation: corticosteroids suppress the adrenal glands. During stress, e.g., surgery, additional steroids may be required to prevent adrenal crisis. 38. A nurse is caring for a patient taking allopurinol. Which instruction should the nurse emphasize? 1. Take with vitamin C to enhance absorption. 2. Increase fluid intake to prevent kidney stones. 3. Avoid dairy products while on this medication. Answer: increase fluid intake to prevent kidney stones. Explanation: allopurinol can increase uric acid excretion, and high fluid intake helps prevent uric acid kidney stones. 39. A nurse is teaching a patient about the side effects of hydrochlorothiazide. What should the patient be instructed to monitor? 1. Heart rate. 2. Muscle weakness or cramping. 3. Weight gain. Answer: muscle weakness or cramping. Explanation: thiazide diuretics can cause hypokalemia, which may present as muscle weakness, cramps, or irregular heartbeats. 40. A patient receiving a monoamine oxidase inhibitor, MALI, asks about foods to avoid. Which food should the nurse instruct the patient to avoid? 1. Roasted chicken. 2. Cheddar cheese. 3. Fresh fruit. Answer: cheddar cheese. Explanation: MAOIs can cause hypertensive crisis when combined with tyramine-rich foods like aged cheeses. 41. A nurse is caring for a patient taking digoxin. Which findings should the nurse report immediately? 1. Heart rate of 58 bpm. 2. Nausea and blurred vision. 3. Blood pressure of 140 over 90 mmHg. Answer: nausea and blurred vision. Explanation: nausea and blurred vision are signs of digoxin toxicity. These symptoms should be reported immediately to prevent cardiac complications. 42. A patient is prescribed warfarin. Which lab value is used to monitor therapeutic effectiveness? 1. APTT. 2. INR. 3. Platelet count. Answer: INR. Explanation: INR, International Normalized Ratio, is the standard lab value for monitoring warfarin effectiveness and adjusting dosing. 43. A nurse is administering morphine for postoperative pain. What is the nurse's priority assessment? 1. Pain scale rating. 2. Bowel sounds. 3. Respiratory rate. Answer: respiratory rate. Explanation: morphine can cause respiratory depression. Monitoring respiratory rate is a priority to ensure patient safety. 44. A patient taking lithium reports new onset tremors. What should the nurse do first? 1. Reassure the patient. 2. Assess lithium level. 3. Encourage fluid intake. Answer: assess lithium level. Explanation: tremors may indicate lithium toxicity. The serum lithium level should be assessed to determine if levels are in a safe range. 45. A nurse is teaching a patient about metronidazole. Which instruction is most important? 1. Limit dairy intake. 2. Avoid alcohol while taking this medication. 3. Take with antacids to reduce nausea. Answer: avoid alcohol while taking this medication. Explanation: metronidazole can cause a severe disulfiram-like reaction when taken with alcohol, including nausea, vomiting, and hypotension. 46. A patient is prescribed nitroglycerin for angina. Which statement indicates a need for further teaching? 1. I will take up to 3 doses, 5 minutes apart. 2. I should store the tablets in a tightly sealed bottle. 3. I can take it before strenuous activity. Answer: I should store the tablets in a tightly sealed bottle. Explanation: nitroglycerin tablets should be stored in their original dark glass container, not a tightly sealed one, to prevent moisture and light degradation. 47. A nurse is preparing to give a child liquid oral iron. Which action is appropriate? 1. Mix with milk to reduce stomach upset. 2. Use a straw to avoid teeth staining. 3. Give on a full stomach. Answer: use a straw to avoid teeth staining. Explanation: liquid iron can stain teeth. Using a straw helps prevent this. Milk and food can reduce absorption. 48. A patient on spironolactone asks about salt substitutes. What is the nurse's best response? 1. They are a healthy alternative to table salt. 2. You should avoid them due to their high potassium content. 3. They have no effect on your medication. Answer: you should avoid them due to their high potassium content. Explanation: spironolactone is a potassium-sparing diuretic, and salt substitutes often contain potassium, increasing the risk of hyperkalemia. 49. A patient on phenytoin develops a rash. What is the nurse's next action? 1. Continue the medication and monitor closely. 2. Discontinue medication immediately. 3. Notify the provider. Answer: notify the provider. Explanation: a rash may indicate a serious reaction like Stevens-Johnson syndrome. The provider must be notified immediately. 50. A nurse is preparing to administer for potassium chloride. What is the most important safety action? 1. Administer as a rapid forepush. 2. Dilute the medication and infuse slowly. 3. Monitor blood pressure continuously. Answer: dilute the medication and infuse slowly. Explanation: for potassium must always be diluted and given slowly to prevent fatal arrhythmias. It should never be administered as a rapid forepush. 51. A nurse is providing education to a patient taking isoniazid for tuberculosis. Which instruction is most important? 1. Avoid caffeine. 2. Take with vitamin B6. 3. Avoid dairy products. Answer: take with vitamin B6. Explanation: isoniazid can cause peripheral neuropathy, which can be prevented by taking vitamin B6, pyridoxine. 52. A nurse is caring for a patient receiving vancomycin 4. Which assessment is most important to prevent complications? 1. Assess for ototoxicity. 2. Check glucose levels. 3. Monitor pupil response. Answer: assess for ototoxicity. Explanation: vancomycin can cause ototoxicity and nephrotoxicity. Monitoring for signs like tinnitus or hearing loss is essential. 53. A patient is prescribed methyldopa for hypertension during pregnancy. Which adverse effect should the nurse monitor for? 1. Proteinuria. 2. Liver dysfunction. 3. Increased fetal heart rate. Answer: liver dysfunction. Explanation: methyldopa can cause hepatotoxicity. Monitoring liver enzymes and signs of hepatic damage is important. 54. A nurse is administering heparin subcutaneously. Which action is correct? 1. Massage the site after injection. 2. Aspirate before injection. 3. Inject into the abdomen and avoid rubbing. Answer: inject into the abdomen and avoid rubbing. Explanation: heparin should be injected subcutaneously in the abdomen without rubbing to prevent hematoma formation. 55. A nurse is reviewing a prescription for linezolid. Which medication should the nurse question if also prescribed? 1. Acetaminophen. 2. Sertraline. 3. Metformin. Answer: sertraline. Explanation: linezolid is a weak MALI and should not be used with SSRIs like sertraline due to the risk of serotonin syndrome. 56. A nurse is caring for a patient with asthma who is prescribed Monteliacast. Which statement by the patient indicates a need for further education? 1. I will take this every day in the evening. 2. I will use it during an asthma attack. 3. This helps prevent my symptoms. Answer: I will use it during an asthma attack. Explanation: Monteliacast is a maintenance medication and is not effective for acute asthma attacks. 57. A patient taking prednisone for chronic inflammation reports black, tarry stools. What is the nurse's priority action? 1. Encourage fluids. 2. Notify the provider immediately. 3. Reassure the patient. Answer: notify the provider immediately. Explanation: black, tarry stools may indicate gastrointestinal bleeding, a known side effect of corticosteroids like prednisone. 58. A nurse is caring for a patient on gentamicin therapy. Which lab result indicates a need for intervention? 1. BUN 28 mg per deciliter. 2. Hemoglobin 12G/DL. 3. Potassium 4.1 milliequivalent/L. Answer: BUN 28 mg per deciliter. Explanation: elevated BUN may indicate nephrotoxicity, a known adverse effect of aminoglycosides like gentamicin. 59. A nurse is preparing to give a beta blocker. Which finding would cause the nurse to hold the dose and notify the provider? 1. BP 110/70 mmHg. 2. HR 50 BPM. 3. O2 saturation 95%. Answer: HR 50 BPM. Explanation: beta blockers decrease heart rate. A heart rate of 50 BPM is bradycardic and may require withholding the dose. 60. A nurse is providing discharge teaching to a patient prescribed levothyroxine. Which statement indicates understanding? 1. I will take this with breakfast. 2. I will take it at night to help sleep. 3. I will take it in the morning on an empty stomach. Answer: I will take it in the morning on an empty stomach. Explanation: levothyroxine is best absorbed on an empty stomach, typically 30 to 60 minutes before breakfast in the morning. 61. A nurse is reviewing the medication list of a patient on clopidogrel. Which medication would the nurse question? 1. Aspirin. 2. Metoprolol. 3. Atorvastatin. Answer: aspirin. Explanation. Both clopidogrel and aspirin have antiplatelet effects, increasing the risk of bleeding when used together. 62. A patient with chronic kidney disease is prescribed aluminum hydroxide. What is the purpose of this medication? 1. To neutralize gastric acid. 2. To bind phosphate in the GI tract. 3. To treat constipation. Answer. To bind phosphate in the GI tract. Explanation. Aluminum hydroxide is used as a phosphate binder in CKD to reduce serum phosphate levels. 63. A nurse administers naloxone to a patient with respiratory depression. What is the most important follow-up action? 1. Reassess pain level. 2. Monitor for recurrent respiratory depression. 3. Monitor urine output. Answer. Monitor for recurrent respiratory depression. Explanation. Naloxone has a shorter half-life than opioids, so respiratory depression can recur once it wears off. 64. A patient with Parkinson's disease is prescribed levodopa-carbidopa. Which dietary instruction is most appropriate? 1. Increase protein intake. 2. Take with high-fat foods. 3. Avoid high-protein meals. Answer. Avoid high-protein meals. Explanation. High-protein meals can interfere with the absorption of levodopa, reducing its effectiveness. 65. A nurse is educating a patient about alendronate for osteoporosis. Which instruction is correct? 1. Take with a full glass of milk. 2. Lie down for 30 minutes after taking. 3. Sit upright for at least 30 minutes. Answer. Sit upright for at least 30 minutes. Explanation. Alendronate can cause esophageal irritation. Sitting upright prevents reflux and esophagitis. 66. A nurse is reviewing a new prescription for fluoxetine. What is the priority patient teaching? 1. May cause weight loss. 2. Takes several weeks to take effect. 3. Can be stopped abruptly. Answer. Takes several weeks to take effect. Explanation. Fluoxetine and SSRI typically takes 4 to 6 weeks to reach therapeutic effect. This should be explained to promote adherence. 67. A patient taking furosemide reports muscle cramps. What is the nurse's best response? 1. Encourage activity. 2. Check potassium levels. 3. Suggest increasing sodium intake. Answer. Check potassium levels. Explanation. Furosemide is a loop diuretic that causes potassium loss. Muscle cramps may indicate hypokalemia. 68. A patient is prescribed rifampin for tuberculosis. Which teaching is most important? 1. May cause drowsiness. 2. May turn body fluids orange. 3. Take with food to avoid GI upset. Answer. May turn body fluids orange. Explanation. Rifampin commonly turns urine, sweat, and tears orange-red, which is harmless but may alarm patients. 69. A nurse is caring for a patient prescribed amiodarone. Which adverse effect requires immediate attention? 1. Dry cough. 2. Nausea. 3. Constipation. Answer. Dry cough. Explanation. A dry cough may indicate pulmonary toxicity, a serious adverse effect of amiodarone, and requires prompt evaluation. 70. A patient with diabetes is prescribed prednisone. What is the nurse's priority action? 1. Monitor blood glucose levels. 2. Assess weight weekly. 3. Encourage low-sodium diet. Answer. Monitor blood glucose levels. Explanation. Corticosteroids like prednisone can elevate blood glucose, especially in diabetic patients. 71. A nurse is caring for a patient prescribed enoxaparin. What teaching is most appropriate? 1. Massage the site after injection. 2. Avoid taking aspirin. 3. Take this medication with food. Answer. Avoid taking aspirin. Explanation. Aspirin increases bleeding risk when taken with anticoagulants like enoxaparin. 72. A patient taking methotrexate for rheumatoid arthritis develops a sore throat. What should the nurse do first? 1. Reassure the patient. 2. Document the finding. 3. Notify the provider. Answer. Notify the provider. Explanation. A sore throat may indicate infection due to bone marrow suppression. It must be reported promptly. 73. A nurse is preparing to administer atropine preoperatively. What effect should the nurse expect? 1. Increased salivation. 2. Decreased heart rate. 3. Decreased oral secretions. Answer: decreased oral secretions. Explanation: atropine is an anticholinergic used to reduce oral and respiratory secretions before surgery. 74. A nurse is caring for a patient taking valproic acid. Which lab value requires immediate follow-up? 1. Platelet count of 70,000/mm superscript 3. 2. Sodium of 135 milliequivalent/L. 3. Hemoglobin of 13G/DL. Answer: platelet count of 70,000/mm superscript 3. Explanation: valproic acid can cause thrombocytopenia. A low platelet count increases bleeding risk and requires attention. 75. A nurse is educating a patient on nitrofurantoin for urinary tract infection. What is the most important teaching point? 1. May discolor urine brown. 2. Take with antacids. 3. Discontinue once symptoms subside. Answer: may discolor urine brown. Explanation: nitrofurantoin can turn urine brown. This is harmless and should be explained to reduce concern. 76. A patient prescribed captopril reports a persistent dry cough. What should the nurse do? 1. Suggest lozenges. 2. Hold the next dose. 3. Notify the provider. Answer: notify the provider. Explanation: a dry cough is a common side effect of ACE inhibitors like captopril and may require changing the medication. 77. A nurse is administering a new dose of hydralazine. Which assessment is most important? 1. Respiratory rate. 2. Blood pressure. 3. Level of consciousness. Answer: blood pressure. Explanation: hydralazine is a vasodilator used to lower blood pressure. Monitoring BP is essential to avoid hypotension. 78. A patient is started on azithromycin. Which adverse effect should the nurse report to the provider? 1. Mild nausea. 2. Watery diarrhea. 3. Headache. Answer: watery diarrhea. Explanation: watery diarrhea may indicate Clostridioides difficile infection, a serious complication of antibiotic therapy. 79. A nurse is caring for a patient receiving 4-metoclopramide. What side effect requires immediate intervention? 1. Restlessness. 2. Tardive dyskinesia. 3. Dry mouth. Answer: tardive dyskinesia. Explanation: tardive dyskinesia is a serious extrapyramidal symptom characterized by involuntary movements and may be irreversible. 80. A nurse is educating a patient on how to use a nitroglycerin patch. What statement by the patient indicates correct understanding? 1. I will remove the patch at bedtime. 2. I will rotate patch sites weekly. 3. I will apply a patch over my heart daily. Answer: I will remove the patch at bedtime. Explanation: removing the nitroglycerin patch at night prevents nitrate tolerance, maintaining its effectiveness. 81. A patient receiving gentamicin 4 develops tinnitus. What is the nurse's priority action? 1. Reassess in 30 minutes. 2. Continue the infusion. 3. Notify the provider immediately. Answer: notify the provider immediately. Explanation: tinnitus may indicate ototoxicity, a serious adverse effect of gentamicin. Prompt action is needed to prevent permanent hearing loss. 82. A patient is taking lithium for bipolar disorder. Which lab value should the nurse monitor regularly? 1. Blood glucose. 2. Serum sodium. 3. White blood cell count. Answer: serum sodium. Explanation: lithium excretion is affected by sodium levels. Low sodium can lead to lithium toxicity. 83. A nurse administers warfarin. Which patient statement indicates a need for further teaching? 1. I will use an electric razor. 2. I can eat as much spinach as I want. 3. I will have my INR checked regularly. Answer: I can eat as much spinach as I want. Explanation: foods high in vitamin K, like spinach, can reduce the effectiveness of warfarin. Consistency in intake is important. 84. A nurse is providing teaching about phenytoin. Which instructions should the nurse include? 1. Brush and floss daily. 2. Avoid dairy products. 3. Take with antacids. Answer: brush and floss daily. Explanation: phenytoin can cause gingival hyperplasia. Good oral hygiene can help prevent this side effect. 85. A patient on digoxin has a serum potassium of 3.0 milliequivalent/L. What is the nurse's priority? 1. Hold digoxin and notify the provider. 2. Give potassium supplement. 3. Administer digoxin as prescribed. Answer: hold digoxin and notify the provider. Explanation: hypokalemia increases the risk of digoxin toxicity. The medication should be held and the provider notified. 86. A nurse is teaching a patient about simvastatin. Which instruction is most important? 1. Take with grapefruit juice. 2. Take in the morning. 3. Report muscle pain immediately. Answer: report muscle pain immediately. Explanation: muscle pain may indicate rhabdomyolysis, a rare but serious adverse effect of statins. 87. A nurse is caring for a patient prescribed isoniazid. What lab value should be monitored closely? 1. AST and ALT. 2. Creatinine. 3. Hematocrit. Answer: AST and ALT. Explanation: isoniazid is hepatotoxic. Liver enzymes must be monitored to detect liver injury early. 88. A patient receiving morphine 4 becomes drowsy with a respiratory rate of 8 per minute. What is the nurse's first action? 1. Apply oxygen. 2. Administer naloxone. 3. Stop the 4 fluids. Answer: administer naloxone. Explanation: naloxone is the opioid antagonist used to reverse life-threatening respiratory depression caused by morphine. 89. A nurse is preparing to give vancomycin 4. Which action is most important to prevent complications? 1. Administer over 30 minutes. 2. Dilute in dextrose. 3. Infuse slowly over at least 60 minutes. Answer: infuse slowly over at least 60 minutes. Explanation: rapid infusion of vancomycin can cause red man syndrome, a histamine reaction. Slow infusion reduces this risk. 90. A patient is started on metformin. What is the most important teaching point? 1. Avoid alcohol. 2. Expect weight gain. 3. Stop if blood sugar is low. Answer: avoid alcohol. Explanation: alcohol increases the risk of lactic acidosis, a rare but serious side effect of metformin. 91. A nurse is caring for a patient with asthma prescribed theophylline. Which finding is most concerning? 1. Insomnia. 2. Nausea. 3. Palpitations. Answer: palpitations. Explanation: palpitations may indicate theophylline toxicity, especially if accompanied by other CNS or cardiac symptoms. 92. A patient prescribed methimazole for hyperthyroidism develops a fever and sore throat. What should the nurse do? 1. Advise rest and fluids. 2. Reassure the patient. 3. Notify the provider immediately. Answer: notify the provider immediately. Explanation: these symptoms may indicate agranulocytosis, a serious adverse effect of methimazole. Immediate evaluation is needed. 93. A nurse is preparing to give a scheduled dose of diltiazem. The patient's BP is 8856 mm of mercury. What is the nurse's action? 1. Give the medication. 2. Hold the medication and notify the provider. 3. Raise the head of the bed. Answer: hold the medication and notify the provider. Explanation: diltiazem can lower blood pressure further. It should be held when hypotension is present. 94. A patient with type 2 diabetes is prescribed glipizide. What is the most important instruction? 1. Take at bedtime. 2. Skip dose if not eating. 3. Eat extra carbs with each meal. Answer: skip dose if not eating. Explanation: glipizide increases insulin secretion. Skipping meals increases the risk of hypoglycemia. 95. A nurse is caring for a patient taking allopurinol. What is the primary purpose of this medication? 1. Prevent acute gout attacks. 2. Lower serum uric acid levels. 3. Treat gout pain. Answer: lower serum uric acid levels. Explanation: allopurinol helps prevent future gout attacks by reducing uric acid, not by relieving acute pain. 96. A nurse is administering for potassium chloride. What is the priority action? 1. Administer undiluted for fast effect. 2. Infuse slowly using a pump. 3. Shake the bag to mix. Answer: infuse slowly using a pump. Explanation: for potassium must always be administered via pump at a controlled rate to prevent cardiac complications. 97. A nurse is caring for a patient on long-term prednisone therapy. Which finding is most concerning? 1. Mood swings. 2. Delayed wound healing. 3. Moon face. Answer: delayed wound healing. Explanation: long-term corticosteroids suppress immune response and delay healing, increasing infection risk. 98. A nurse is administering insulin glargine. What statement is correct about this insulin? 1. It should be mixed with regular insulin. 2. It is taken with meals. 3. It has no peak and lasts up to 24 hours. Answer: it has no peak and lasts up to 24 hours. Explanation: insulin glargine is a long-acting insulin with no peak, providing steady glucose control. 99. A nurse is preparing to administer ceftriaxone IM. The patient has a penicillin allergy. What is the priority action? 1. Administer as ordered. 2. Hold and notify the provider. 3. Give diphenhydramine first. Answer: hold and notify the provider. Explanation: cephalosporins like ceftriaxone have a cross-sensitivity with penicillin. The provider must be notified before administration. 100. A patient with schizophrenia is taking clozapine. What findings should the nurse report immediately? 1. Mild sedation. 2. Constipation. 3. Fever and sore throat. Answer: fever and sore throat. Explanation: clozapine can cause agranulocytosis. Fever and sore throat may indicate infection due to neutropenia. 101. A patient taking furosemide reports muscle weakness. Which lab value should the nurse review first? 1. Sodium. 2. Potassium. 3. Calcium. Answer: potassium. Explanation: furosemide is a loop diuretic that can cause hypokalemia, leading to muscle weakness and cardiac dysrhythmias. 102. A nurse is administering an opioid to a postoperative patient. What assessment is most important before giving the dose? 1. Pain score. 2. Bowel sounds. 3. Respiratory rate. Answer: respiratory rate. Explanation: opioids can cause respiratory depression. The nurse must assess for adequate respiratory function before administration. 103. A patient receiving enalapril develops a dry, persistent cough. What is the nurse's best action? 1. Instruct the patient to drink water. 2. Notify the provider. 3. Give an antihistamine. Answer: notify the provider. Explanation: a dry cough is a common side effect of ACE inhibitors like enalapril. The provider may switch to an ARB. 104. A nurse is teaching about nitroglycerin tablets. Which statement by the patient requires follow-up? 1. I keep the tablets in a glass bottle. 2. I take 1 tablet every 5 minutes if I have chest pain. 3. I chew the tablets when I have chest pain. Answer: I chew the tablets when I have chest pain. Explanation: nitroglycerin sublingual tablets should be placed under the tongue, not chewed, to ensure rapid absorption. 105. A patient is started on haloperidol. Which side effect is most concerning? 1. Drowsiness. 2. Muscle stiffness and fever. 3. Dry mouth. Answer: muscle stiffness and fever. Explanation: these are signs of neuroleptic malignant syndrome, NMS, a life-threatening reaction to antipsychotics. 106. A patient taking spironolactone has a potassium level of 5.8 milliequivalent/L. What is the nurse's priority? 1. Document the result. 2. Encourage potassium-rich foods. 3. Hold the medication and notify the provider. Answer: hold the medication and notify the provider. Explanation: spironolactone is a potassium-sparing diuretic. Hyperkalemia is a serious complication and requires immediate attention. 107. A nurse is teaching a patient about using a metered dose inhaler with albuterol. Which statement shows understanding? 1. I exhale fully before using it. 2. I breathe in through my nose. 3. I use it right after my corticosteroid inhaler. Answer: I exhale fully before using it. Explanation: proper use includes exhaling completely before inhaling the medication to allow full delivery into the lungs. 108. A patient taking levothyroxine reports feeling jittery and anxious. What is the nurse's priority action? 1. Reassure the patient. 2. Ask about dose adherence. 3. Notify the provider. Answer: notify the provider. Explanation: jitteriness and anxiety may indicate overmedication with levothyroxine, suggesting possible hyperthyroidism. 109. A nurse is reviewing medications for a patient with chronic kidney disease. Which medication order should the nurse question? 1. Acetaminophen. 2. Ibuprofen. 3. Calcium carbonate. Answer: ibuprofen. Explanation: NSAIDs like ibuprofen can worsen renal function and should be avoided in patients with kidney disease. 110. A patient is prescribed heparin and develops hematuria. What is the nurse's best action? 1. Continue the infusion. 2. Stop the infusion and notify the provider. 3. Administer vitamin K. Answer: stop the infusion and notify the provider. Explanation: hematuria may indicate bleeding due to heparin. The nurse must stop the infusion and notify the provider. 111. A nurse is teaching about subcutaneous insulin injections. What statement indicates correct understanding? 1. I'll inject in the same spot each time. 2. I will rotate sites with each dose. 3. I'll use my thigh only. Answer: I will rotate sites with each dose. Explanation: rotating injection sites prevents lipodystrophy and improves absorption of insulin. 112. A patient on warfarin has an INR of 5.2. What is the nurse's priority action? 1. Give the next dose. 2. Hold the dose and notify the provider. 3. Administer heparin. Answer: hold the dose and notify the provider. Explanation: an INR of 5.2 is above the therapeutic range and increases bleeding risk. The provider must be informed. 113. A nurse is administering methotrexate. What is the priority teaching? 1. Take with vitamin C. 2. Avoid pregnancy while taking this medication. 3. Increase fluid intake at bedtime. Answer: avoid pregnancy while taking this medication. Explanation: methotrexate is teratogenic and contraindicated in pregnancy due to the risk of fetal harm. 114. A patient is prescribed clonidine for hypertension. What is the nurse's teaching priority? 1. Avoid sudden withdrawal of the medication. 2. Take with meals. 3. Increase potassium intake. Answer: avoid sudden withdrawal of the medication. Explanation: abrupt discontinuation of clonidine can cause rebound hypertension, which can be severe. 115. A nurse is preparing to administer sublingual nitroglycerin. The patient's BP is 86/60 millimeter of mercury. What is the appropriate action? 1. Administer the medication. 2. Hold the medication and notify the provider. 3. Raise the head of the bed. Answer: hold the medication and notify the provider. Explanation: nitroglycerin lowers blood pressure. It should not be administered when hypotension is present. 116. A nurse is reviewing medications with a patient newly diagnosed with tuberculosis. Which medication should be included? 1. Metronidazole. 2. Rifampin. 3. Azithromycin. Answer: rifampin. Explanation: rifampin is a first-line drug in tuberculosis treatment. It inhibits RNA synthesis in Mycobacterium tuberculosis. 117. A patient reports seeing halos around lights while taking digoxin. What should the nurse do first? 1. Document the finding. 2. Hold the dose and notify the provider. 3. Check the patient's visual acuity. Answer: hold the dose and notify the provider. Explanation: halos are a classic sign of digoxin toxicity, requiring immediate evaluation and intervention. 118. A nurse is caring for a patient on amphotericin B. What is the priority lab to monitor? 1. White blood cell count. 2. Creatinine. 3. Hemoglobin. Answer: creatinine. Explanation: amphotericin B is nephrotoxic. Renal function must be closely monitored during therapy. 119. A patient is prescribed a beta blocker. Which finding would require the nurse to hold the medication? 1. Heart rate 52 BPM. 2. BP 128/78 mmHg. 3. Respiration 16 per minute. Answer: heart rate 52 BPM. Explanation: beta blockers slow the heart rate. A rate below 60 BPM is a common threshold for holding the dose. 120. A patient taking isosorbide mononitrate reports a headache. What should the nurse advise? 1. Stop taking the medication. 2. Take with food. 3. Take acetaminophen as needed. Answer: take acetaminophen as needed. Explanation: headaches are a common side effect of nitrates. Acetaminophen is typically effective in managing them. 121. A patient is started on lithium therapy. Which lab result should be monitored closely? 1. Sodium. 2. Calcium. 3. Magnesium. Answer: sodium. Explanation: sodium levels affect lithium excretion. Low sodium can lead to lithium toxicity. 122. A nurse is teaching a patient prescribed phenytoin. Which statement requires follow-up? 1. I'll brush my teeth regularly. 2. I can stop the medication if I feel well. 3. I'll take the medication at the same time each day. Answer: I can stop the medication if I feel well. Explanation: abruptly stopping phenytoin can trigger seizures. Adherence is critical. 123. A patient receiving gentamicin 4 reports ringing in the ears. What is the nurse's best action? 1. Reassure the patient. 2. Slow the infusion. 3. Stop the medication and notify the provider. Answer: stop the medication and notify the provider. Explanation: ototoxicity is a serious side effect of aminoglycosides like gentamicin. 124. A patient taking metformin reports upcoming imaging with contrast. What is the nurse's priority action? 1. Continue metformin. 2. Hold metformin before and after the test. 3. Increase fluid intake. Answer: hold metformin before and after the test. Explanation: metformin should be held to prevent lactic acidosis associated with for contrast. 125. A nurse is educating a patient on ferrous sulfate. Which instruction is appropriate? 1. Take with milk. 2. Take with vitamin C. 3. Take before bedtime. Answer: take with vitamin C. Explanation: vitamin C enhances the absorption of iron supplements like ferrous sulfate. 126. A patient prescribed morphine 4 has a respiratory rate of 8 per minute. What is the nurse's priority action? 1. Reassess in 30 minutes. 2. Administer naloxone. 3. Elevate the head of the bed. Answer: administer naloxone. Explanation: naloxone is the antidote for opioid-induced respiratory depression. Immediate action is required. 127. A nurse is caring for a patient taking isoniazid. Which lab value is a priority to monitor? 1. Liver enzymes. 2. White blood cells. 3. Hemoglobin. Answer: liver enzymes. Explanation: isoniazid is hepatotoxic. Liver function tests must be monitored regularly. 128. A patient on prednisone reports black, tarry stools. What is the nurse's best response? 1. Document the finding. 2. Encourage more fiber. 3. Notify the provider immediately. Answer: notify the provider immediately. Explanation: black, tarry stools may indicate GI bleeding, a serious complication of corticosteroid use. 129. A patient is prescribed tamsulosin. What teaching is essential? 1. Change position slowly. 2. Take before bedtime. 3. Avoid dairy products. Answer: change position slowly. Explanation: tamsulosin can cause orthostatic hypotension. Patients should be instructed to rise slowly. 130. A nurse is administering vancomycin for. The patient develops flushing and hypotension. What is the likely cause? 1. Allergic reaction. 2. Red man syndrome. 3. Septic shock. Answer: red man syndrome. Explanation: rapid infusion of vancomycin can cause histamine release, leading to red man syndrome. 131. A nurse is educating a patient prescribed alendronate. Which statement requires correction? 1. I'll take it first thing in the morning. 2. I'll lie down for 30 minutes after taking it. 3. I'll take it with a full glass of water. Answer: I'll lie down for 30 minutes after taking it. Explanation: patients must remain upright for at least 30 minutes after alendronate to prevent esophageal irritation. 132. A patient taking levodopa-carbidopa reports new involuntary movements. What is the nurse's best action? 1. Encourage ambulation. 2. Hold the dose and notify the provider. 3. Reassure the patient. Answer: hold the dose and notify the provider. Explanation: involuntary movements can be a sign of toxicity or overdose with Parkinson's medications. 133. A patient taking sulfonylureas is found diaphoretic and confused. What is the likely cause? 1. Hyperglycemia. 2. Hypoglycemia. 3. Hyponatremia. Answer: hypoglycemia. Explanation: sulfonylureas can cause hypoglycemia, especially if the patient skips meals. 134. A patient is prescribed digoxin. Which heart rate should prompt the nurse to withhold the dose? 1. 90 bpm. 2. 72 bpm. 3. 56 bpm. Answer: 56 bpm. Explanation: digoxin is withheld if the apical heart rate is below 60 bpm to prevent bradycardia. 135. A nurse is teaching a patient about atorvastatin. What symptoms should be reported immediately? 1. Headache. 2. Muscle pain. 3. Constipation. Answer: muscle pain. Explanation: statins can cause rhabdomyolysis, a serious condition involving muscle breakdown. 136. A patient asks why they need to avoid grapefruit juice with their medication. What is the best explanation? 1. It increases the effectiveness. 2. It can cause serious side effects. 3. It has no real effect. Answer: it can cause serious side effects. Explanation: grapefruit juice can inhibit drug metabolism and increase drug levels to toxic ranges. 137. A nurse is administering a calcium channel blocker. What side effect should be monitored? 1. Hypertension. 2. Bradycardia. 3. Insomnia. Answer: bradycardia. Explanation: calcium channel blockers like verapamil and diltiazem can cause bradycardia. 138. A patient on fluoxetine reports increased energy and suicidal thoughts. What is the nurse's priority? 1. Educate the patient. 2. Notify the provider immediately. 3. Schedule a follow-up visit. Answer: notify the provider immediately. Explanation: increased energy with suicidal thoughts may indicate increased suicide risk in early antidepressant use. 139. A nurse is teaching about warfarin therapy. What food should the patient limit? 1. Leafy greens. 2. Milk. 3. Citrus fruits. Answer: leafy greens. Explanation: leafy greens are high in vitamin K, which antagonizes the effects of warfarin. 140. A patient on hydrochlorothiazide complains of muscle cramps. What lab result supports the symptom? 1. Hyperkalemia. 2. Hypokalemia. 3. Hypernatremia. Answer: hypokalemia. Explanation: thiazide diuretics like hydrochlorothiazide can cause potassium loss, leading to muscle cramps. 141. A patient taking spironolactone reports palpitations and muscle weakness. What is the nurse's priority assessment? 1. Potassium level. 2. Calcium level. 3. Sodium level. Answer: potassium level. Explanation: spironolactone is a potassium-sparing diuretic and can cause hyperkalemia, leading to palpitations and weakness. 142. A patient is prescribed rifampin for tuberculosis. What should the nurse include in patient teaching? 1. Your urine may turn orange. 2. Avoid dairy products. 3. Take with antacids. Answer: your urine may turn orange. Explanation: rifampin can cause body fluids, urine, sweat, tears, to turn orange, which is harmless, but should be expected. 143. A nurse is monitoring a patient on heparin therapy. Which lab value is most important? 1. INR. 2. Platelet count. 3. APTT. Answer: APTT. Explanation: activated partial thromboplastin time, APTT, is used to monitor therapeutic response to heparin. 144. A patient is receiving methotrexate for rheumatoid arthritis. Which finding is most concerning? 1. Mild nausea. 2. Bruising. 3. Fatigue after activity. Answer: bruising. Explanation: methotrexate can cause bone marrow suppression, increasing bleeding risk indicated by bruising. 145. A nurse is reviewing a prescription for nitroglycerin patches. What is a correct instruction? 1. Apply one every 12 hours and remove at night. 2. Apply over the same site daily. 3. Cover with a heating pad for better absorption. Answer: apply one every 12 hours and remove at night. Explanation: a nitrate-free period helps prevent tolerance. Patches should be removed at night. 146. A patient on furosemide therapy has a potassium level of 2.8 milliequivalent/L. What is the most appropriate nursing action? 1. Encourage fluid intake. 2. Hold the next dose and notify the provider. 3. Administer calcium gluconate. Answer: hold the next dose and notify the provider. Explanation: furosemide can cause hypokalemia, and potassium at 2.8 milliequivalent/L is dangerously low. 147. A patient receiving codeine reports difficulty breathing and severe drowsiness. What is the nurse's priority? 1. Provide oxygen. 2. Administer naloxone. 3. Encourage deep breathing. Answer: administer naloxone. Explanation: naloxone reverses opioid toxicity symptoms such as respiratory depression and sedation. 149. A patient is prescribed warfarin. Which over-the-counter medication should be avoided? 1. Acetaminophen. 2. Ibuprofen. 3. Loratadine. Answer: ibuprofen. Explanation: NSAIDs like ibuprofen increase bleeding risk when taken with anticoagulants like warfarin. 150. A nurse is caring for a patient with bipolar disorder, starting valproic acid. Which lab value should be monitored? 1. Liver enzymes. 2. TSH. 3. Potassium. Answer: liver enzymes. Explanation: valproic acid can cause hepatotoxicity. Liver function tests must be routinely monitored. 151. A nurse is preparing to administer erythromycin. Which potential adverse effect should be reported? 1. Diarrhea. 2. Prolonged QT interval. 3. Headache. Answer: prolonged QT interval. Explanation: macrolide antibiotics like erythromycin can cause QT prolongation, increasing the risk of arrhythmias. 152. A patient with asthma is prescribed theophylline. Which symptom suggests toxicity? 1. Diarrhea. 2. Restlessness and tachycardia. 3. Hypotension. Answer: restlessness, and tachycardia. Explanation: theophylline toxicity can manifest as CNS stimulation, including restlessness, tachycardia, and seizures. 153. A nurse is educating a patient taking levothyroxine. Which statement indicates a need for further teaching? 1. I'll take it every morning before breakfast. 2. I can stop the medication when my symptoms improve. 3. I'll avoid iron supplements within 4 hours. Answer: I can stop the medication when my symptoms improve. Explanation: levothyroxine is typically lifelong therapy for hypothyroidism and should not be stopped abruptly. 154. A patient on clozapine reports a sore throat and fever. What is the nurse's priority action? 1. Encourage fluids. 2. Check white blood cell count. 3. Schedule a clinic visit. Answer: check white blood cell count. Explanation: clozapine can cause agranulocytosis, so WBC must be evaluated immediately if infection is suspected. 155. A nurse is administering adenosine for supraventricular tachycardia. What is expected immediately after administration? 1. Permanent bradycardia. 2. A brief period of asystole. 3. Tachycardia rebound. Answer: a brief period of asystole. Explanation: adenosine causes a short pause in cardiac activity, allowing rhythm correction. This is expected and transient. 156. A nurse is preparing to give 4 potassium chloride. What is an appropriate administration guideline? 1. For push over 1 minute. 2. Dilute and infuse slowly via 4 pump. 3. Mix with normal saline and give rapidly. Answer: dilute and infuse slowly via 4 pump. Explanation: for potassium must never be given as a push and should be diluted and infused slowly to avoid cardiac complications. 157. A patient receiving enoxaparin asks why lab monitoring isn't required. What is the best response by the nurse? 1. It's a short-acting drug. 2. It doesn't affect clotting factors. 3. It has predictable therapeutic effects. Answer: it has predictable therapeutic effects. Explanation: low molecular weight heparins like enoxaparin have predictable pharmacokinetics and typically don't require routine lab monitoring. 158. A nurse is reviewing prescriptions for a patient taking digoxin and furosemide. Which finding is most concerning? 1. Potassium 3.1 milliequivalent/L. 2. Apical pulse 65 bpm. 3. Urine output 600 milliliters per day. Answer: potassium 3.1 milliequivalent/L. Explanation: hypokalemia increases the risk of digoxin toxicity. Potassium level should be corrected before administering digoxin. 159. A patient reports drinking alcohol while on metronidazole. What is the nurse's most appropriate response? 1. You may feel sleepy. 2. There is a risk of a severe reaction. 3. It may increase effectiveness. Answer: there is a risk of a severe reaction. Explanation: metronidazole can cause a disulfiram-like reaction with alcohol, including nausea, vomiting, and hypotension. 160. A nurse is preparing to administer oxytocin to a laboring patient. What is the nurse's priority before administration? 1. Ensure 4 access. 2. Monitor blood glucose. 3. Assess fetal heart rate and contractions. Answer: assess fetal heart rate and contractions. Explanation: oxytocin stimulates uterine contractions, so fetal monitoring is essential to detect distress or hyperstimulation. 161. A nurse is administering lisinopril to a patient with hypertension. What is the most important assessment prior to administration? 1. Heart rate. 2. Blood pressure. 3. Respiratory rate. Answer: blood pressure. Explanation: lisinopril is an ACE inhibitor used to lower blood pressure. It should not be administered if the patient is hypotensive. 162. A patient taking lithium reports nausea, tremors, and confusion. What is the nurse's priority action? 1. Administer the next dose. 2. Check serum lithium level. 3. Encourage fluid intake. Answer: Check serum lithium level. Explanation: these symptoms suggest lithium toxicity, which must be confirmed with serum levels before continuing therapy. 163. A patient receiving vancomycin via for complains of itching and redness on the face and upper body. What is the nurse's best action? 1. Stop the infusion and notify the provider. 2. Slow the infusion rate. 3. Administer an antihistamine and continue at the same rate. Answer: slow the infusion rate. Explanation: this is likely red man syndrome, a common reaction to rapid infusion of vancomycin, managed by slowing the rate. 164. A nurse is teaching a patient prescribed alendronate. Which instruction is essential? 1. Take with food. 2. Lie down after taking it. 3. Remain upright for 30 minutes. Answer: remain upright for 30 minutes. Explanation: alendronate can cause esophageal irritation. Remaining upright reduces this risk. 165. A patient on long-term corticosteroid therapy is at increased risk for which condition? 1. Hyponatremia. 2. Osteoporosis. 3. Bradycardia. Answer: osteoporosis. Explanation: corticosteroids decrease calcium absorption and bone formation, increasing the risk for osteoporosis. 166. A nurse is giving atropine preoperatively. What is the expected effect? 1. Increase respiratory secretions. 2. Dry oral secretions. 3. Lower blood pressure. Answer: dry oral secretions. Explanation: atropine is an anticholinergic that reduces secretions and prevents aspiration during surgery. 167. A patient is prescribed doxycycline for an infection. What instructions should the nurse include? 1. Take with milk. 2. Avoid sun exposure. 3. Take at bedtime. Answer: avoid sun exposure. Explanation: doxycycline increases photosensitivity, and patients should avoid sun or use protection to prevent burns. 168. A patient taking MALIs asks about dietary restrictions. What food should the patient avoid? 1. Milk. 2. Aged cheese. 3. Apples. Answer: aged cheese. Explanation: foods high in tyramine, such as aged cheese, can cause hypertensive crisis when taken with MALIs. 169. A nurse is reviewing lab results for a patient on carbamazepine. Which value requires immediate action? 1. Sodium 135 milliequivalent/L. 2. WBC count 2, 800/mm, superscript 3. 3. Platelet count 200, 000/mm, superscript 3. Answer: WBC count 2, 800/mm, superscript 3. Explanation: carbamazepine can cause agranulocytosis. A low WBC count is life-threatening and requires urgent intervention. 170. A patient taking phenytoin has a phenytoin level of 25 micrograms per milliliter. What is the nurse's best action? 1. Administer the next dose. 2. Hold the medication and notify the provider. 3. Double the next dose. Answer: hold the medication and notify the provider. Explanation: therapeutic phenytoin levels are 10 to 20 mcg/ml. A level of 25 indicates toxicity. 171. A nurse is administering subcutaneous enoxaparin. What is the correct technique? 1. Aspirate before injecting. 2. Inject into the deltoid muscle. 3. Do not expel the air bubble. Answer: do not expel the air bubble. Explanation: the air bubble ensures the full dose is delivered and helps prevent bruising at the site. 172. A patient taking amiodarone develops a persistent cough and shortness of breath. What is the priority nursing action? 1. Encourage coughing and deep breathing. 2. Discontinue the medication and notify the provider. 3. Continue the medication and reassess in 1 hour. Answer: discontinue the medication and notify the provider. Explanation: amiodarone can cause pulmonary toxicity. New respiratory symptoms require immediate discontinuation and evaluation. 173. A patient is starting bupropion for smoking cessation. What should the nurse monitor for? 1. Seizures. 2. Weight gain. 3. Bradycardia. Answer: seizures. Explanation: bupropion lowers the seizure threshold, especially at high doses or in predisposed patients. 174. A nurse is educating a patient on levodopa-carbidopa. Which statement shows understanding? 1. I will take it with high-protein meals. 2. It may cause dark urine. 3. It will cure my Parkinson's. Answer: it may cause dark urine. Explanation: levodopa can cause harmless discoloration of urine and sweat. However, high-protein meals should be avoided. 175. A patient with cancer is receiving ondansetron. What is the most important side effect to monitor? 1. Constipation. 2. QT prolongation. 3. Increased appetite. Answer: QT prolongation. Explanation: ondansetron can cause QT interval prolongation, increasing the risk for serious arrhythmias. 176. A patient is prescribed sucralfate. When should it be administered for maximum effectiveness? 1. After meals. 2. Before meals. 3. With antacids. Answer: before meals. Explanation: sucralfate works by coating the stomach lining and should be taken before meals for best protection. 177. A patient receiving isoniazid for TB is also prescribed pyridoxine. What is the reason for this combination? 1. To enhance absorption. 2. To prevent peripheral neuropathy. 3. To reduce nausea. Answer: to prevent peripheral neuropathy. Explanation: isoniazid can cause vitamin B6 deficiency leading to neuropathy. Pyridoxine prevents this. 178. A patient on clonidine abruptly stops the medication. What is the primary concern? 1. Sedation. 2. Rebound hypertension. 3. Bradycardia. Answer: rebound hypertension. Explanation: sudden withdrawal of clonidine can lead to a dangerous spike in blood pressure. 179. A nurse is administering morphine. What is the priority assessment? 1. Blood pressure. 2. Respiratory rate. 3. Bowel sounds. Answer: respiratory rate. Explanation: opioids can cause respiratory depression, so respiratory rate must be closely monitored. 180. A patient taking hydrochlorothiazide reports muscle cramps and weakness. What lab value should the nurse check? 1. Calcium. 2. Potassium. 3. Chloride. Answer: potassium. Explanation: thiazide diuretics can cause hypokalemia, which leads to muscle cramps and weakness. 181. A nurse is caring for a patient receiving digoxin. What is the priority assessment before administration? 1. Pulse rate. 2. Blood pressure. 3. Respiratory rate. Answer: pulse rate. Explanation: digoxin can slow the heart rate, so the nurse must assess the pulse to ensure it is not below 60 bpm before administration. 182. A patient on warfarin therapy is about to undergo surgery. What should the nurse monitor prior to the procedure? 1. INR. 2. Platelet count. 3. Hemoglobin level. Answer: INR. Explanation: the International Normalized Ratio, INR, measures the therapeutic effect of warfarin. It must be monitored to ensure safe surgery. 183. A patient taking warfarin asks about vitamin K-rich foods. What is the best response? 1. You can eat them freely. 2. Limit them to small amounts. 3. Avoid them completely. Answer: limit them to small amounts. Explanation: vitamin K can interfere with warfarin's anticoagulant effect, so it should be consumed in consistent, small amounts. 184. A nurse is teaching a patient about oral contraceptives. Which statement shows understanding? 1. I can skip a dose if I forget. 2. I should take them at the same time every day. 3. I need to take them with food. Answer: I should take them at the same time every day. Explanation: consistent timing maximizes the effectiveness of oral contraceptives and reduces the risk of pregnancy. 185. A patient receiving 4 potassium complains of burning at the injection site. What should the nurse do? 1. Slow the infusion rate. 2. Discontinue the infusion immediately. 3. Change the 4 site. Answer: slow the infusion rate. Explanation: potassium infusions can cause irritation at the injection site. Slowing the rate can alleviate the discomfort. 186. A nurse is administering nitroglycerin for chest pain. What should the nurse assess first? 1. Blood pressure. 2. Heart rate. 3. Respiratory rate. Answer: blood pressure. Explanation: nitroglycerin dilates blood vessels, which can cause hypotension, so blood pressure must be monitored before and after administration. 187. A patient is prescribed hydrochlorothiazide for hypertension. What is the priority nursing intervention? 1. Monitor potassium levels. 2. Monitor blood glucose levels. 3. Monitor sodium levels. Answer: monitor potassium levels. Explanation: thiazide diuretics like hydrochlorothiazide can cause hypokalemia, so potassium levels should be closely monitored. 188. A patient is prescribed methotrexate for rheumatoid arthritis. Which instruction should the nurse provide? 1. Take it with milk to reduce stomach upset. 2. Avoid alcohol while taking this medication. 3. Increase your folic acid intake. Answer: avoid alcohol while taking this medication. Explanation: methotrexate can cause liver toxicity, and alcohol can exacerbate this risk. 189. A patient taking hydrochlorothiazide and digoxin reports nausea and vomiting. What is the nurse's priority action? 1. Check the blood pressure. 2. Check the potassium level. 3. Administer an antiemetic. Answer: check the potassium level. Explanation: both digoxin and hydrochlorothiazide can cause hypokalemia, which can increase the risk of digoxin toxicity. 190. A patient receiving morphine via patient-controlled analgesia, PCA, is drowsy and has shallow breathing. What should the nurse do? 1. Administer naloxone. 2. Increase the PCA dose. 3. Encourage the patient to increase fluid intake. Answer: administer naloxone. Explanation: drowsiness and shallow breathing are signs of opioid overdose. Naloxone is the antidote to reverse respiratory depression. 191. A patient receiving diuretics is at risk for which electrolyte imbalance? 1. Hyperkalemia. 2. Hypokalemia. 3. Hypercalcemia. Answer: hypokalemia. Explanation: most diuretics, especially loop and thiazide diuretics, increase potassium excretion, leading to hypokalemia. 192. A nurse is preparing to administer insulin to a patient. Which action is correct? 1. Shake the vial to mix insulin. 2. Inject air into the insulin vial before drawing. 3. Draw insulin into the syringe before preparing other medications. Answer: inject air into the insulin vial before drawing. Explanation: injecting air into the vial before drawing insulin prevents a vacuum from forming and allows for easier withdrawal. 193. A patient on antidepressants asks about sexual side effects. Which medication is most likely to cause sexual dysfunction? 1. Sertraline SSRI. 2. Bupropion NDRI. 3. Mirtazapine TCA. Answer: sertraline SSRI. Explanation: SSRIs like sertraline are commonly associated with sexual dysfunction, including decreased libido and delayed orgasm. 194. A nurse is caring for a patient taking ACE inhibitors. Which side effect should the nurse report immediately? 1. Dizziness. 2. Cough. 3. Angioedema. Answer: angioedema. Explanation: angioedema is a serious side effect of ACE inhibitors that can cause airway obstruction and requires immediate intervention. 195. A patient receiving heparin has an APTT of 90 seconds. What is the nurse's next action? 1. Administer the heparin as scheduled. 2. Stop the heparin infusion and notify the provider. 3. Increase the heparin dose. Answer: Stop the heparin infusion and notify the provider. Explanation: an APTT of 90 seconds is above the therapeutic range for heparin, indicating the risk for bleeding. 196. A nurse is administering a dose of acetaminophen. The patient's liver function tests are elevated. What should the nurse do? 1. Administer the dose as prescribed. 2. Contact the provider for a dose adjustment. 3. Discontinue the medication immediately. Answer: contact the provider for a dose adjustment. Explanation: elevated liver function tests suggest impaired liver function, and acetaminophen can be toxic to the liver, requiring dose adjustment. 197. A nurse is teaching a patient taking warfarin about potential drug interactions. Which over-the-counter medication should the patient avoid? 1. Acetaminophen. 2. Ibuprofen. 3. Vitamin C. Answer: ibuprofen. Explanation: ibuprofen can increase the risk of bleeding when taken with warfarin, so it should be avoided. 198. A nurse is caring for a patient receiving an opioid analgesic. Which side effect should the nurse prioritize for monitoring? 1. Urinary retention. 2. Respiratory depression. 3. Nausea. Answer: respiratory depression. Explanation: respiratory depression is a life-threatening side effect of opioids, requiring close monitoring and immediate intervention if it occurs. 199. A patient taking sildenafil for erectile dysfunction complains of chest pain. What is the nurse's priority action? 1. Monitor for further symptoms. 2. Administer nitroglycerin as prescribed. 3. Contact the provider immediately. Answer: contact the provider immediately. Explanation: sildenafil should not be taken with nitrates due to the risk of a dangerous drop in blood pressure, so the provider should be contacted immediately. 200. A patient prescribed furosemide asks why they need to increase their potassium intake. What is the nurse's best response? 1. It helps prevent dehydration. 2. It prevents low potassium levels. 3. It helps with medication absorption. Answer: it prevents low potassium levels. Explanation: furosemide is a diuretic that can cause potassium loss, so increasing potassium intake helps prevent hypokalemia.